Thank you, everyone. Now I'd like to introduce our first presenter for the day, Associate Professor Mridula Sharma, Course Director for the Master of Clinical Audiology.
Thank you. Thank you, Gareth, for the introduction, and welcome. Welcome to the world of speech and hearing. I've been at it for some years and I still love it. So I hope you guys get excited about this program, this course, as much as both Scott and I do. So to begin with, that's my email there. And as Gareth said, I am the course director for Master of Clinical Audiology. So just to give you a little bit of an idea here of what audiology is, in case you haven't come across the field or you're not sure entirely. So we kind of view audiology as a combination of science and art. So it's kind of like it is science because we're looking at the mechanisms that underlie anything to do with hearing. But then the art happens to involve because we work with humans, we work with people, all ages, and no two people, even if they have the same kind of a hearing or a hearing loss, actually have the same expectations and requirements. And that's where the art component comes into it. So audiology really is all about prevention, detection, diagnosis, management of hearing loss and its associated disorders. So we look at all ages. Some of you may be working or have had an experience of a newborn baby getting a hearing loss. I know Scott may have just had that with his newborn baby. So we are able to assess the hearing skills of babies born within the 24 hours, and we can assess a person's hearing loss or their hearing abilities at any age, whether they have had any kind of a disorder, disease, injury. That's what we do. We look at their hearing skills, but that's not all. If you've been on a roller coaster and you after that you feel a little I guess dizzy, that actually also has something to do with your ears. The ears are not just involved in hearing, they're also involved in balance function. So we look at that as well. We look at not just about the degree of hearing loss or the kind of hearing loss, we also then evaluate, well, what's the impact of that hearing loss and what can we do about it? Therefore, the rehabilitation, the management at all ages, that's a part of our job. And yes, it does involve working with technology because there is a fair amount of devices. And if you're following Google's, then wearables or hearables are the new thing in the market. But that's not all. There are implantable devices, but all of that, while some of it might involve a surgeon in terms of inserting the implant, but managing it, designing it, planning it is the audiologist's job. So there are lots of different, I guess, tasks and skills that are required when you become an audiologist. And one more thing I just want to highlight, for instance, you probably have, I don't know if you've thought about it, but let me give you an example. Listen to this tone. It's not a pitch, it's a tone that's varying in pitch. And this is a tone we use, for instance, when we're testing young infants. But that's just to know if a person perceives a signal. But look at this sound. Now, hopefully you know what that is, but I can tell you whenever I do ask, I'm either told, oh, it's tapping, it's knocking, it's actually Roadrunner, the animated cartoon. But why am I making you listen to this? The reason is because hearing is not just percept of a sound, it's then associating meaning to it. And your auditory pathway all the way from cochlea to the cortex enables you to make a judgment call. It's a life-saving skill as well. For instance, if you heard something like this, you may think it's a creaky door, which it could be, but it's actually a dropping of a branch. And you would want to run if you heard that. So that's a part of your auditory processing as well. So the idea that audiology is only about hearing loss, not quite. It has a number of different variations of what we do, not just in terms of clinical work, but also in terms of rehabilitation, management, etc. So another, I guess, reality at the moment is that there are about 360 million people worldwide who experience disabling hearing loss. That is, that it makes their life a little more difficult in terms of managing their everyday living. And more literature is starting to look at the consequences or its association of the hearing loss to general wellness and how it impacts our cognition. So that's something which is current big question in the field. So knowing that as a background, the bottom line really is that audiology is in demand. With aging population, it's a current reality. We need to be able to manage if you think about the wellness model of well-being, then from that perspective, hearing is a big component of that. So how do you actually enter into this program? Or this course? So there's an undergraduate degree that is required, but it is not specific. You can have any undergraduate degree, but you do need to have a credit average or a VAM of 65 at least, and that's your requirement to apply. But in addition, we do expect a 2-page personal statement where you tell us a little more about what do you understand about audiology, why do you want to be in the field of audiology, and what's your experience, what is it that's relevant from your experience that would be of interest to us to understand your interest. So in terms of the degree, the completion of degree, well, there is a 6 months to a year of a supervised work internship, but that is after the program, and it's not a requirement. That really is an industry thing. That is, often it's a paid experience, and you can be an independently practicing audiologist. So after the 2-year degree, you can work as an audiologist. The industry requires an internship, but that's additional and in some ways not a part of your degree. So, but a necessary aspect, and you need to understand that there is a requirement of that internship. In terms of the course structure, ours runs a little different from the university, because what we have is a block teaching program. So we've got blocks where you learn, so if you think about a whole session being 13 weeks, then we normally have classes for about 6 weeks, where you come 3 times a week. Well, at the moment, everything's online, but ours is in a blended program in any case. But there are hands-on components for which you come into the university, and then 6 weeks we place you in different to get a clinical experience before you come back for exams. We've highlighted the units that you would take if you were to enroll in the program in the year 1. Often our year 1 is all about learning about diagnosis, and the second year is more about management and rehabilitation across ages. In terms of the clinical placements, we organize those. We negotiate with the industry so we can provide you with a wide variety of experience, not just in hospital settings, private sector, but also in clinics in regional remote areas. So as far as Audiology Australia, which is the parent, I guess, organization for us, it recommends and requires that there is a formal, intensive, relationship-based education and training that is case-focused and supports, directs, and guides students' clinical development. And every session, we ensure that our students have some level of that clinical exposure. All placements are, as I said, we organize them, public hospitals, government agencies, private clinics, non-for-profit organization. We're doing a lot more of screening programs in schools, community health centers. There is a requirement at the moment for 250 clinical hours, but more and more we're going into a competency-based clinical experience. As I said, placements are in blocks. Now, while I said the 6 weeks are allocated within each session for clinical placements, no one student goes for all the 6 weeks, because after all, there's time that you need to do your assessments, your quizzes, etc. So we try that every semester, each student has at least 2 or 3 set of placements, and we try and organize the placements to be at least a week long. That way, you go to you go to the same clinic, you build consistent, sustained clinical exposure. And we try and get as many regional centers as well as the Sydney metropolitan areas. But the only caveat, and you need to know this, is that the placement costs are the student responsibility. We try and organize and figure out budget accommodation. And there are some grants and scholarships that we make available for the students. Why should you study at Macquarie? Well, because we are highly ranked when it comes to audiology or the hearing course. We are a core member of Australian Hearing Hub. It's one of a kind. It have a focus on translational hearing research. Ours is an accredited, professionally accredited degree program, and you can work. Our students internationally, our students, more and more students have gone to New Zealand, they go to UK. The program offers practical experience in wide, diverse range of clinical placements. And we have a very specific focus on the social view of hearing health care, with, of course, cutting edge technology. As I said, that it is within the setting, is within the Hearing Hub. There are focused and tailor-made teaching spaces, clinical teaching spaces. We have the equipment. We also are focusing on trying to get a private hospital to have audiology student placements. Our clinic downstairs on the ground level of Hearing Hub has excellent training facilities. It's busy. We get a large number of clinical clients that are, and this clinic is a dedicated clinical experience space as well. And of course, we collaborate with Cochlear, which is right across and on our campus when we are designing clinic research, for instance, for our students. In addition, you should know that we offer 12 Commonwealth supported placements. They are merit-based. However, there are rural remote grants as well. There's a criteria that takes that into account. Hearing Australia also offers one scholarship to anybody who identifies with the Aboriginal and or Torres Strait Island group. And if they're accepted into the audiology program, this is a scholarship that's made available. In terms of job prospects, that's often a question that's asked. The last year, I can say most of our graduates, they are employed pretty much. Sometimes some of the students get their job offers before they graduate, before they actually even complete the program. But but more or less everybody gets a job within the first 3 to 6 months of completion. But there are more jobs in the remote and regional areas at the moment than there are in city centers. So you need to accept that your first job may be in a remote or a regional place. That's all I wanted to say. So thank you for listening, but I'm around for questions. But before we do that, I'm going to hand over to Scott to take over.
Okay, thank you very much, Mridula. This should be my screen now, I think, rather than your screen. Many of the features of the Master of Clinical Audiology are also shared by the Master of Speech and Language Pathology. I'll try to dwell on the things that are unique to speech pathology and highlight a couple of common features that our programs share, common advantages that our programs share. So, first slide is me. I'm the course director of the Master of Speech and Language Pathology at Macquarie. I'm a speech pathologist by training, but have moved over into the dark side of research. Clinically, I've worked with both children and adults, and most of my research nowadays focuses on interactions involving people with acquired communication disabilities. So disabilities that have been acquired during adulthood, usually as a consequence of brain injury. So that's me. And yeah, you can feel free to get in touch with me too using that contact detail. And I'll do my best to respond as quickly as I can. So to begin with, a little bit about speech pathology for those of you who might be less familiar with it. Speech pathology is a professional field that's dedicated to working with and supporting people who have communication and swallowing disabilities. Now, communication and swallowing disabilities can arise across the lifespan, and that's one of the really nice things about speech pathology. You can work with a very diverse set of people, from very, very young children to the oldest members of our community and everything in between. People do tend to specialise in one or more areas as they enter the workforce, but when you graduate from an accredited speech pathology degree program, we'll get to what that means in a moment, you can work across the whole scope, the whole range of our practice with a wide variety of different people. So some of the core populations that speech pathologists work with include people who've experienced a brain injury during adulthood, as I mentioned a moment ago. So something like a stroke or a traumatic brain injury that causes changes to people's speech, language, and communication. You can also work with people who have problems that emerge during their development in childhood. So maybe children who are late to speak, have patterns of speech errors, learning and literacy difficulties, or children with complex developmental issues such as autism, for instance. We also work with people who have difficulty communicating via speech or via speech alone. So people who might use augmentative or alternative communication devices, people with cerebral palsy or other complex motor disorders, motor neurone disease, for example. We also work closely with people who stutter and have issues with speech fluency. And again, across the lifespan, from very young children to adults who experience that condition. We also work with people who have age-related diseases. So people with dementia are a really good example of age-related degenerative disease population that speech pathologists work closely with. So those are the kinds of people that you'll see in work as a speech pathologist, but what do we actually do with them? The first thing to note is that we diagnose communication and swallowing disorders. So that means we detect the presence or absence of some underlying pathology that's affecting people's communication or swallowing. If we do detect a kind of disorder, we also identify its features. So someone might have a brain injury and experience language problems as a consequence of that, it's a speech pathologist's role to say whether they're there or not, and then talk about how language has been affected by that brain injury. Once we've diagnosed a problem, then it's our responsibility as speech pathologists to develop intervention plans for our clients that really focus on treating their communication and swallowing disabilities. With speech pathology intervention, we can engage in a really diverse range of activities here, from things that are very heavily medicalized and really focused on changing people's brain function and cognition, to things that are really about facilitating participation in everyday life, engagement in society. Yeah, so obviously a big gamut of activities there covered in speech pathology practice. Speech pathologists are also really focused on improving service delivery for our clients, ensuring that people have access to the highest quality speech pathology care. So this might mean looking at changing the way services are oriented for people, or conducting research to develop evidence for our speech pathology activities. And on top of that, speech pathologists also have a role in advocating for people and communities that are affected by communication and swallowing disorders and their associated disabilities. Okay, so now I'm going to talk a little bit about speech pathology education in Australia and the context for that, and then talk a bit about Macquarie in particular and its current status among speech pathology programs. So the professional association that is responsible for speech pathology in Australia is quite cryptically called Speech Pathology Australia. This is the peak professional body for speech pathology, and it has a role in accrediting degree programs in Australia. So basically what that means is that Speech Pathology Australia decides whether university degree programs meet the requirements for practice as a speech pathologist, whether they have the necessary range and depth of skills that are required for speech pathology work. And really the point of this is to ensure that speech pathologists who are graduating and entering the workforce meet the standards for the profession, and that the public is receiving high quality healthcare from speech pathologists. Now, some of the degree programs that are accredited in Australia are undergraduate degrees, so 4-year bachelor's degrees, while others are postgraduate degrees, usually 2-year postgraduate degrees. Both of these ways of entering the profession are treated as equally valid in Australia. It's not the case in some places overseas, North America, for instance, that tends to strongly prefer postgraduate qualifications. But here, both undergraduate and postgraduate qualifications are treated as equal for entry into the speech pathology profession. If you go onto the Speech Pathology Australia website, you can find a full list of accredited degree programs in the country. So you can see who's offering accredited degrees. You can also see the status of accredited degrees. So some degrees might be partially accredited, undergoing accreditation, or not currently accredited. Now, fortunately for us, and through a lot of hard work from us, the Master of Speech and Language Pathology is an accredited degree program, so which means once you complete it successfully, you can work as a speech pathologist in Australia and apply for practicing membership of Speech Pathology Australia. Our last accreditation for our degree program was back in 2017. We have another one coming up in the reasonably near future, and this was the 4th time that our degree program has been accredited. So we have a long history of success on that front. Okay, so what does the study pathway look like for people entering our degree and then exiting our degree? So in the first step, people who are entering our degree have an undergraduate degree program, have completed an undergraduate degree program recently that includes linguistics and psychology. Now, that's an important difference between our degree and the Master of Clinical Audiology. We do have very specific prerequisite studies for entry to our program. These are provided by the Bachelor of Speech, Hearing and Language Sciences, or the Bachelor of Speech and Hearing Sciences. Now I think it's shifted back to that at Macquarie. So students who are completing that degree can get the prerequisites required for entry. However, there might be other equivalent degrees that people have completed that have the required studies in linguistics and psychology that we're looking for, and that's a fine way to come into the degree program too. That information is available on the course website, so you can pursue that there if you like. Once you've completed your undergraduate degree with those prerequisites, then you can apply for entry to the Master of Speech and Language Pathology. As per the Master of Clinical Audiology, we are expecting a credit average or a WAM of 65 for entry. And then you'll get the fun of engaging in 2 years of learning to be a speech pathologist with us. And once that's done, you're able to work as a speech pathologist. You can apply for, as I said a moment ago, practicing membership of Speech Pathology Australia. Speech pathology doesn't have an internship period like audiology. You can just go out and get into the workforce. And yeah, hopefully, as Mridula said before, we really, really love what we do for work, and hopefully you'll love what you do as a speech pathologist too. Okay, so within our degree program, we have a variety of placement opportunities. Something that makes our degree program a little bit distinctive in terms of postgraduate speech pathology qualifications. We do have clinical placements from very early in the program. So you'll be taking clinical placement from about the 3rd or 4th week after starting in the degree program. We do like people getting out into placements early and often. We think that's really, really important. And we do place you in a very wide range of sites over the course of the degree. As Mridula mentioned, we have the really lovely Macquarie University Speech and Hearing Clinic on campus, which takes a lot of our students and provides a really high quality speech pathology service to the surrounding community. We do currently provide services to Macquarie University Hospital as well, the inpatient service. There's also a motor neurone disease clinic and a head and neck cancer clinic that we provide services to. We also have placement agreements with a variety of hospitals and community health centres around the Sydney metropolitan region. And we're increasingly, as Mridula said as well, using not-for-profit organisations. We have schools that we work in and provide services to. Basically, anywhere speech pathology work happens, you can expect there to be a Macquarie University student in there somewhere. And yeah, I think, again, that really speaks to the diversity of the profession. You can work in a really wide range of contexts with a really wide range of people. And ideally, we look to give you that breadth of experience through our degree. As I said a moment ago, accredited degree programs are all kind of working you towards the same point of competency, being ready to enter the speech pathology profession. And Speech Pathology Australia's role is to ensure that graduates meet a very similar level of competency when they're entering the workforce. This doesn't mean that all programs are the same, however, and there are very different flavours that emerge in different degree programs. You know, some might have a little bit of a business flavour, others might have more of a health and medicine flavour, others might have more of a psychology flavour. Because of where we are in a Department of Linguistics and where we are at Macquarie, where we have such excellent speech and language research around us, we do have a strong focus on integrating basic findings about speech, language and communication into clinical practice. So if language and linguistics is something you really love, then we might be the speech pathology degree program for you, because we really love it too. And that's really at the forefront of a lot of our learning and teaching in the Master of Speech and Language Pathology. We also really want to enable our graduates, our students, to be clinicians rather than technicians. It's a bit of a slogan, but what it sort of means is that we want to be able to give you the thinking skills that you require to make sound, evidence-based decisions about your client and the people who you're working with. It's very easy to do lots of speech pathology tasks in quite a mechanical way without thinking about the reasons behind them. We really encourage you to think about the reasons, the theoretical basis, the empirical basis for speech pathology work. And we have a lot of great fun doing that. Of course, we also want our graduates to be really innovative and really responsive to the challenges that the speech pathology workforce and the health workforce in general faces. I'm really proud to say that the Speech and Hearing Clinic on campus has been taking up telehealth in a really big way, both before and during the COVID crisis. And I think we really want to make sure that our graduates, even in really extreme circumstances like the current ones, can be flexible, innovative, creative members of our profession. And that's something we try and foster over the course of the degree. As I've been getting at, we do have really lots of places that speech pathologists can work, and our graduates are really highly sought after. It's usually the case that by the time of April graduations, most of our students do have jobs and are working as speech pathologists. Mridula can also correct me if I'm wrong about this. She might have heard a similar bit of information, but I think in the second half of last year, speech pathology and audiology were the highest growing job advertisement on Seek. So I think we're really in demand at the moment, and that demand is just going to increase. Did you hear that, Mridula?
Yes, I did. It's been on and out. BBC at one point had reported, so yeah.
That's fantastic. I think, yeah, we're a real growth industry, and rightly so. People do need more speech pathology and audiology services, and we should be more available to the community. So hooray us. Okay, as I was saying before, I think what really makes us distinctive is our focus on language and communication. We do have a lot of excellent researchers and teachers in this area. We're developing at the moment some new units of study that are focused on practice with multilingual people, and being in Sydney, which is a richly and diversely multilingual city. We think that's really, really important, and we really do want to encourage multilingual people to enter our degree program, so we can ensure that you're really making a difference for multilingual communities in Sydney. Something else that's also worth noting, I guess, in terms of postgraduate degree programs, having a postgraduate qualification does make you a little bit more portable worldwide. Speech Pathology Australia has mutual recognition agreements with a variety of speech pathology professional bodies around the world, and postgraduate qualifications do tend to be more of the norm internationally, so it can make it a little bit easier to practice overseas if we're ever allowed to travel overseas again. And on top of that, some employers do recognise postgraduate qualifications as being more desirable than undergraduate qualifications. So for instance, in New South Wales Health, speech pathologists do start on a slightly higher step if they have a postgraduate qualification as opposed to an undergraduate qualification.